protecting and taking care of your eyesight. So myself, Dr. Alkesh Chaudhary. So I have a one very good advanced MD Eye Care and Laser Center in Greater Class Part 2 in New Delhi. So I'll be telling you how you can protect your eye vision. So it is importance of vision. First of all, an eye is our important sensory organ. कहते हैं no sight, no word. So out of sight, out of mind. So vision is a window to the world where we can enjoy window, we can see the world, we can enjoy the world, we can appreciate. And 80% of our all memories are determined by what we see. So that's why we say out of sight, out of mind. So why World Sight Day? So important is now 2.2 billions globally present, which has an unaddressed vision impairment of blindness. So they need to be addressed to take care of their blindness. Sight and vision. Sight is a physical, it is a sensory organ. So it helps whatever we see. Our eye is like a, you can say, camera, which makes an image, and finally, like a, you can see if you compare with a computer. So eye is like a our screen, and your brain is the CPU. Finally, it is all the signals what we receive through the eye are analyzed by our brain, and brain tells us whatever we see, and that we learn as we grow. So like to a child, you will say, for example, it is a chair, so his brain will record that, yes, the object, what we see like this thing, it is like a chair. So that's why our brain and eye is a learning process where we learn the things. So eye, you can see, has a different, very complicated structure, which is not a simple thing. So basically you can see this diagram. So it has a multiple layer, which has a lens, cornea, retina. So these are very important structure which are enclosed in a chamber. And common eye, what are the common eye problems? So first of all, you can say refractive error means you need glasses of different type of glasses. Secondly, the dry eye, when there is a lack of your fluid formation. Digital strains, like working for longer hours on the computer, allergic conjunctivitis, color blindness, night blindness. Then lazy eye, like in the children, their problem different, mainly in the children and the old age. In the children, lazy eye, when eye is not used, maybe sometime because of the refractive error, high refractive error, they're not using glasses. Then squint, like squinting of the eye, one eye is focused, other eye is not focused. So third is the ptosis. Ptosis means drooping of the eyelid, which may block your pupillary area and child is not able to see. And old age, presbyopia, decrease near vision, cataract, opacification of the normal human lens, glaucoma, and there is increased pressure. And then is the age-related macular degeneration. So with the age, like older age, your macula become weak, and it may lead to fall of vision. Then is the diabetic retinopathies. So because of the diabetes, especially the long-standing diabetes after the 15 years, so retina gets affected. The all vessels, they start leaking and start affecting the vision. So refractive error like myopia, we call it nearsightedness. Then hyperopia is a plus power. So is a basically we call it a farsightedness also, where the patient can see for the distance, but near he has a more problem. Then amblyopia is a lazy eye, when during the childhood, the child has not been prescribed proper glasses. So it may lead to amblyopia of the lazy eye. So that eye stops working. So to get rectified that, basically we need a patching exercise and stimulation exercise. So we stimulate that lazy eye so that vision can improve. Then you can see the astigmatism. Astigmatism is cylindrical power. Like we have a cross section, like a network, you see horizontal and vertical lines. So in which astigmatism, cylindrical power, you can focus only one line, either horizontal and vertical. And that's why in that axis you need glasses. Like you see in a pole, is able to focus the vertical line, not able to focus the horizontal lines. Strabismus or squint, when there is a dissociation between the two eyes. So eyes are not coordinating, which is like walking on two legs. Same way, walking with two eyes, seeing with two eyes, which gives you a basically depth perception, 3-dimensional vision. So that is lost in cases of squint. So usually in these cases, first we try with the glasses, and thirdly, if not improved, then we can operate and rectify these squints. So earlier we attend these squint problems, the better we get the results, better coordination between the two eyes we get. Ptosis is the droopy eyes. So if they cover the pupil area, you can see the center normal reflex. You see this is the cornea reflex. So in this droopy eye, you see the center cornea is covered. So he's not able to see, it's just blocking. So we just do the surgery and raise the eyelid so that patient starts seeing. Then corneal ulcer. Corneal ulcer can be different types like fungal, viral, and bacterial. So sometimes because of the injury or long-standing infection, you see there is a opacification of the cornea. So cornea get ulcer. There is a wound in the cornea which may lead to later on opacity and loss of vision. If it is a permanent opacity which blocks this pupillary area, then we may need a cornea transplant. Initially, we treat the corneal ulcer, we heal them. So sometimes this opacity may go down and patient may start seeing. If it doesn't happen, we may need later on cornea transplant. So basically we have to, this is the most common cause of this type of ulcer is frequent rubbing, regular infections into the eye, they lead to corneal ulcers. Then conjunctivitis. So red eye, pink eye, whatever you call, is the most common cause is the infection, and second is the allergy. Allergy sometimes with the season, sometimes exposure to different allergens like perfumes, sometimes to the pollens, sometimes to the fibers, cotton. So different reason of the allergic allergy. So accordingly, we have to consult with our physician and get the treatment for different things. Not like that you keep on treating on your own. I remember one of the patient of allergic conjunctivitis, he was initially prescribed steroid by somebody because he was in acute state, but he continued those steroid and lost his eye because of glaucoma. So don't continue any medicine on your own. Do consult your physician and then. And cataract is opacification of the normal human lens. Our eye has a human lens which helps in focusing, which has a power around 20 diopter with age. So it loses vitality and leads to opacification of the human lens. So there is more simple treatment and recovery of vision is 100%. So whenever there is a loss of vision, you do consult your doctor and get operated as early as possible because of the now advancement of cataract surgery is so high, the recovery is immediate. So you can see the difference. This is the cataract, so which is being treated with a phacoemulsification, which is the lower newest latest technique. We remove this whole lens and implant. You can see the lens we can implant of different power, even if they have some abnormal power. So they can rectify with that also. So now you see the cataract surgery. Now we have very advanced cataract surgery, recovery immediate. You can see these are the lenses which are implanted. Now glaucoma. See, the glaucoma is increase in pressure of the eyeball. So we can always first treatment part of is basically we detect all these things on a routine examination when there is increase in pressure. So eyes basically you see they supply get a nutrition with the help of a transparent liquid, like our body is gets nutrition with the help of a blood. So our eye gets a nutrition from the a clear fluid. We call it aqueous humor and the vitreous humor. When there is a collection of the aqueous humor in the anterior chamber here, in this you see there is a constant circulation of the fluid. It supplies the nutrition and the dirty fluid gets drained. So once there is a blockage, so this fluid gets collecting here and leads to increase in pressure. Increase in pressure, this pressure build up, so leads to this damage of the optic nerve. Optic nerve is basically the connection between the eye and the brain. So if it gets damaged, so there is a leads to permanent loss of vision. So early detection, early treatment is very, very important to prevent the vision. That's why we call it in Hindi, we call it a kala motia. So once there is a loss of vision, so recovery is very poor. So it's always better to detect, treat initially with the medicine. If not controlled with the medicine, then surgery with success, very high success rate. So you see the diagnosis, different is a field analyzer, then on slit lamp examination, this to measure the pressure of the eyeball, then different scannings, OCT. So these are battery of tests are required to uh, monitor the glaucoma progression. So you see the initial eye drops, then with the help of a laser, and then finally we need a different surgeries, filtering surgeries, so where we make a bypass channel to enhance the circulation. Age-related macular degeneration, we call it ARMD. So this is a macular area. You see there is a formation of drusen's, small, they are deposits in the retinal, subretinal layer, which leads to loss of vision. So there is a early detection of these drusen's, and diagnosis is very important. So OCT, with the help of OCT, we can see there is a leakage, swelling, or they are dry. So we can give antioxidants initially to prevent further progression. And then if there is a leakage, we can use anti-VEGF injection, which can help in improving the eyes and retaining the vision and prevent further loss of vision. And thirdly is another investigation for ARMD is fluorescent angiography, where we can see the leakage. And this diabetic retinopathy, now see the with our lifestyle and the dietary habits, the diabetes is increasing day by day. So diabetes is very important, started from the childhood diabetes and the old age diabetes. Diabetes is a blinding disease, so it is very important to get a regular checkup. So lead to blur vision, fluctuating vision, impaired color vision, dark or empty areas in your vision. So duration of diabetes, research duration of diabetes is the most important factor. So usually after 15 years of the diabetes, you start getting changes in your retina. Doesn't mean like you have a diabetes of 5 you don't get check your eyes. Initially, you may not be knowing how long is diabetes. So always get it checked. Even those changes will tell you how long your diabetes is there, which went undetected initially. So add on to that high blood pressure, high cholesterol, tobacco use, they also add on to this diabetic damage. If they, you have to control your blood pressure, you have to fluctuation of blood sugar level also cause further increase in diabetes. So fluctuation blood sugar level should not be too much. So is a basically to prevent the progression, and regular checkup if required. Any leakage on fluorescent angiography, again on OCT examination, we need laser treatment. And if there is a vitreous hemorrhage in cases of diabetes, so it may need a surgery to improve the further vision. Then this is the now digitalization of the whole world, which is coming up, especially in COVID era. You see a lot of we are working. So this leads to a lot of eye strain, sitting regularly on eye strain. Sometimes you don't have a proper glasses, sometimes because of the presbyopia. So there are so many causes, sometimes because of dry eye. So you may get eye strain, and this should be attended, should not be taken lightly. You see extended computer or other devices like mobile, gaming, etc. used with inadequate and excessive cause of strain. So it leads to lot of strain. So it is always better we should attend, don't ignore it, and using lubricant drops and proper taking care of your glasses. And depending on the uh, so what happen in eye strain may lead to blur vision, double vision, irritation, stinging, watery eyes, may lead to redness, intense headache, feeling of distribution, difficulty in focusing. In COVID era also you see even classes are happening from the home. Or so many work there from home means working on a computer, sitting on a computer. So basically, the when you get on a strain on the eyes, it means your blinking is less. You're not blinking properly. Basically, you're sitting on computer without blinking. The simple formula, like while working, and press the enter button, blink. Press the enter button, blink. And secondly, what you can do is half an hour, 45 minutes working, half an hour rather, preferably. Every half an hour, you just take a break, and just take a break of 5 minutes, close your eyes. And beside this, you can use lubricant drops to lubricate your eyes, which basically constant watching on computer lead to dry eye also. So difficulty in reading, impact on our daily lives, difficulty in reading, then shopping for groceries, working on laptop. So these are basically while we are working on sitting on a computer or laptop, ordering all those things. Tips to prevent eye strains. What are the tips? Proper distance maintaining, lowering the brightness, diffuse illumination. You should always work in diffuse illumination. Wash your eyes regularly. And so that I told you, diffuse illumination, and blink more often looking at computer. And use nighttime setting to minimize blue light exposure. So lastly, I will tell you that basically lubricant eyes and blinking should be normal and rest in between the working hours. So, and besides this, we will definitely tell you, you need a regular checkup, not like that when you have a problem, then you visit a doctor, because by that time, when you are facing yourself problem, then you go, it problem has already increased. They say, can nip the evil in the bud. So it is always better you visit your doctor regularly, so that any initial stages we can detect those problems and treat them. There are different eye testing. You see visual acuity, and you're giving glasses power, visual field test, slit lamp examination, retinal examination, screening of glaucoma, cataract, diabetes. So these all those things are required. So regular checkup is very, very important. So eyes are your most important part of the, and at the last but not least, we must pledge, take a pledge to donate your eyes and give light to the people, needy people, help the impaired to see the beauty of life. So we pledge to donate our eyes. Thank you so much. Thank you very much.